All right, actress Angelina Jolie is making headlines after choosing to undergo a double mastectomy, a move that has launched a national conversation. But bringing it back locally, we brought in America's fitness doctor to weigh in on her decision. Welcome, Dr. Rob.
Hello, how are you?
We have so much to get through. I mean, obviously, what Angelina Jolie did was a very personal health choice, obviously, and it seemed as though she wanted to empower women and give them the knowledge of what she did and why she did it. And I think the two big things we're hearing all over the news is BRCA1 and BRCA2. And I didn't really know what those were prior to her undergoing the double mastectomy. So what are those two things?
Well, that's a great question, Vanessa. And BRCA1 and BRCA2 stands for breast cancer susceptibility gene 1 and 2. And all women have these genes. What we're looking for when we do the BRCA analysis test is we're looking for the mutations of those genes.
Right, and if I'm not incorrect, the BRCA1 was the mutated gene that Angelina Jolie had. Is that correct?
Well, as far as I know, just based on some of the articles I was able to read, because in trying to get relevant information and truthful information, it looked like it was the BRCA1 gene.
BRCA1, and she had an 82% chance based on her genetic predisposition that she was going to get breast cancer, either 82% or 87%.
I think in the New York Times article, it said it was 87%.
Right.
For women that do test positive with the BRCA analysis for 1 and 2 for the breast gene, what we're looking at is about a 60% increased risk.
Right.
So Miss Jolie had additional factors. She must have had a very strong, significant family history of her mother having cancer, and I'm sure that there were some second and third degree relatives that most likely also had cancer. And that's what would make that percentage go up. And those are things that you have to discuss with your physician, because when you take these tests, you have to know how to interpret the data and how to use the data. Because when you think about the social aspect of this, about the fact that she had to make this decision where I'm going to remove both of my breasts to protect my life, to care for my children, what an incredibly brave and thing to do.
Right. Now, we only have 1 minute. We also saw a national discussion, I think, with Hoda talking about it. She also had breast cancer on the Today Show, but it's really a personal decision. I mean, Angelina choosing to do what she did brought her percentage of getting cancer down to 4%. So, I mean, it's a fair exchange. But looking at the actual test that you brought here today, tell us what we need to do to get our hands on this. I understand there's a survey you have to do before you should actually do the test.
Well, the BRCA analysis has to be ordered by your physician.
Right.
And what I would encourage women to do is you can go to BRCAnow.com and you can take a questionnaire. That when you take this questionnaire, it'll ask specific questions that'll decide what's your risk. And then you can print that out and you can take it to your doctor and you can discuss that questionnaire with your doctor and you can make a decision about, hey, do we need to order this test to see if you have the mutated genes of BRCA1 and BRCA2? Because it is a very expensive test. It runs in the neighborhood of about $3,000.
Wow.
And the insurance companies, about 90% of the time, do pay for those or do reimburse for this test.
Okay.
So if you have a strong family history of first, second, third degree relatives that have had breast cancer or ovarian cancer, runs in your family, this is a very useful tool. And I have ordered this in patients, and we get this form back right here, and it gives you the results.
Well, there's so much to get to, obviously, Dr. Rob, but we have to wrap up. But you said something very important. Talk to your family, find out what that genetic predisposition is. Thank you so much for talking to us, Dr. Rob. All right, guys, stay tuned.